nobody sets out to be an addict. It's not a choice. One of the very first heroin addicts I ever met said, from the first time I ever took heroin, I knew I would never again be without it because it makes everything all right. And it's that feeling that gets people hooked so badly. And one of the problems I have with docs and other providers is they discover that the patient has been overusing and they cut them off right then, and the patient is left in this withdrawal system that you all heard about. And instead of what they should be doing is saying, yes, I'm mad at you and I'm not going to prescribe for you anymore, but I will taper you off and help you with withdrawal with what I've been prescribing for you. That would help a lot. Suboxone, buprenorphine, is the single most effective tool we have towards addiction. It's using an agonist-antagonist opioid, which, yes, gives a little bit of the feel-good feeling, but then becomes a blocker, so you can't use anything else when you're on it. More people are being treated with it than anything else in the country, with greater success, and there's data that backs that up from the National Institutes of Health and everything else. And yet, in the papers, Maggie Hassan, the WMUR, whatever it is, nobody mentions it, because it's a substitute treatment. I'm very, very much in favor of people being abstinent if they can, but the data would say that when people try to get drug-free from opioids with no treatment, 90 to 95% of them fail and relapse over and over and over again.
Understanding addiction is really important. We know that about 20 million people are currently recovering for addiction to alcohol or any drugs in the United States. They face many issues. All these issues can put them right back into relapse. Unfortunately, many of them aren't getting help. We have about 22 million people out there not getting help for their addiction. But really, what is addiction? Why do people get hooked to this? And I think very naively for many families that he can just stop. Let's just stop that. Well, it's not that easy. So the National Institute of Drug Abuse defines addiction as a chronic, relapsing disease that is characterized by a compulsive drug seeking and use despite harmful consequences. It's not good for you. It's like the person that is trying to lose weight, but you have this beautiful pizza with all kinds of pepperoni in it, and you can't do it, you just had a heart attack, but it's looking at you, has your name all over it, and you just have to have it, because it has your name on it, and you have it. And you have it, after you have it, you feel guilty, and you don't know what to do. Same idea. So patients go from a cycle of treatment, recovery, relapse, remission, and many times this is just a cycle. You go on and on with the cycle. Drug abuse, unfortunately, and this is very true, and it's important for parents, fathers, mothers to know these, but drug abuse changes the function of the brain, and many things can trigger drug cravings within the brain. It's critical for patients that are going to treatment, especially those treated at inpatient facilities, to learn and recognize what the triggers are. They all have triggers. If I can't have pizza because I'm going to have another heart attack, I really do not want to go to the local pizza shop because I know I'm going to have pizza, right? Same thing happens, so we tell our patients, recognize your triggers, and you know that you need to deal with those triggers. Addiction is a complex disease, very complex, but it's treatable. Counseling, behavior therapy is there for people that need it. Medications, there's many medications out there for treatment. People that go on medications need to be monitored very closely. And thankfully, many of us are comfortable prescribing some of these drugs. Some of us are not, and we do need the training on these, and we're not given this training many times. Also, you need to understand that many patients that have addiction have also other mental health problems. Many of these patients are severely depressed, have PTSD, ADD, ADHD, schizophrenia, anxiety, depression, And that needs to be addressed, number one, in order for them to become sober. Treatment doesn't always have to be voluntary, and I know that I hear in the rooms where patients, people say, well, you need to be ready. Well, sometimes we can make you ready, and we need to tell you that you are ready, that you had enough, and it's time to change, time to turn around and stop, and we need to give you the help when you need it. Also, understand that patients that have been using heroin is not just the heroin that is killing them, but it's the hepatitis C that they have acquired when they injected that needle in their veins. I manage currently about 30 hepatitis C positive patients that are extremely ill. And this is how recovery happens. The relapse prevention plan is what we want everyone to have. Family support, lean on close friends, build a sober social network, consider moving to a sober living home like the one Jim has. What a beautiful thing. And if you think about how the disease works, if you had MS, would you want to care for another person that had MS and is doing better? She will completely understand what you're going through. Jim understands what you're going through. You and I maybe won't, but he does. He's been through it. So what a beautiful place. But guess what? He's not being funded by anybody. He's singly handling the whole situation on his own. I don't know how, but he's doing it. Also, going to meetings. And we know if you keep going to meetings works if you work it.
Substance use disorder is a family disease, meaning that if you have a loved one in your home that is using, it's not affecting just that person, it's affecting everyone. The parents, the siblings, whoever else is living in that home. I am a parent to a daughter that has a substance use disorder, and it's been a 6-year battle. Thankfully, I can say that she's now in recovery, but it does affect you. And so I'm here to represent the FASTA group, which it stands for Families Advocating Substance Treatment, Education, and Recovery. And the people that would benefit from this, it basically calls it a parents' peer support group, but it's really for anybody that's being affected by a loved one's use. It could be an adult sibling or a spouse, a significant other, it could be a grandparent. One thing about the FASTA group is that you do have to be an adult, 18 years old or older. It's free, it's confidential. You can come and you can feel like you're finally being understood, and there's no judgment and no shaming. It's a place to get information and learn of resources, and it's a place to just feel understood. And we also discuss all aspects of this disease. It's not just about your loved ones using. I felt ashamed, I felt alone, I felt frustrated, and misunderstood. And I had that fear at nighttime, going to bed and not being able to sleep and laying there wondering, is tonight going to be the night that I get that knock on the door being told that my daughter has OD'd? You just, as much as you don't want to have those feelings, you have them. I struggled often with, I don't want my daughter to go to jail, but at the same time, I wanted the police to pick her up so badly to bring her to jail so that I could know that she was at least safe. And so the FASTA group is just a place to just really feel understood. The FASTA group is, if you're a parent and you're sitting out there tonight and you're thinking, well, my daughter only smokes pot, it's not a big deal. Or you're sitting there thinking, well, my son's only 13, he can't be addicted to anything yet. That's not true. Substance use disorder has no discrimination against drug, age, socioeconomic status. It doesn't matter. If you think that they're possibly using, you're probably right. And then I just want to finish by just saying that the meetings, I hold them on the first and the third Monday of every month from 6:30 to 8 at the Connect Center at right here in Opera House Square. And I hope that some of you will come out and seek the support that's offered.
I suffer from the disease of substance abuse disorder, and I'm a person in long-term recovery. My story isn't really that much different from anyone else's. I grew up in a very active alcoholic family. I was exposed to the many ways that it not only affected my family members negatively, but myself as well. I have a lot of happy childhood memories, but I also have a lot of sad and horrific ones as well. As a teenager, I began to party and use drugs recreationally. I graduated from high school in 1986, and I was able to leave the party life at that time because I got pregnant with my first child. I was married at age 19, I had my second child at 21, and my third when I was 24. I still had fun partying a lot of times, but I was very focused on my family and work also. I started having some serious health issues in my late teens and early 20s, and was prescribed a lot of pain medications, but I remember being able to take them safely and even having extra leftovers sometimes. But sometime around the age of 25, things started getting really blurry for me. The lines got crossed, and I started getting addicted to these medications. I was able to stay in denial about it because I did have a lot of pain issues, and I sometimes had 3 or 4 surgeries a year where the medications were necessary, and so I didn't realize when I had crossed the line from normal use to being addicted to these medications. For some years I was still able to function as a wife and mother, an employee, and a productive citizen. But when I was 28, I had a sort of nervous breakdown, and I was introduced to benzodiazepines at that time. And my addiction quickly took over, and I became a person that nobody recognized anymore, and I wasn't able to function in any capacity in my life. My husband at the time gave me an ultimatum to get my life together within a year. In that year, I had my first brush with the law, went to my first detox and treatment, and was put on probation for 3 years for prescription fraud. I could not stay clean for any amount of time, even after treatment, and in the spring of that year, I was diagnosed with hepatitis C. When this happened, I was kicked out of my home, and my marriage ended. For the whole next year, I stayed literally I was in a blackout. I don't remember much about that first year away from my kids and my marriage. The following spring, I had my first overdose and was found unconscious on the kitchen floor. I don't remember anything until about 5 days later, where I woke up in the psychiatric ward at Dartmouth, and once I was able to get up and move around, the nurses said, "You need to start going to these groups." So at my first group I went to, I met my second husband, and his alcoholism was just as severe as my addiction, and it was not a match made in heaven by any means. He was also on probation. He turned out to be a very abusive man, both physically and emotionally. I couldn't get clean for any amount of time in this situation, but I thought I was in love, so I gave up everything, including my home, to follow him here to Claremont and live in the homeless shelter. Probation did not think that we should be together due to his record and his history, so after 2 months of knowing him, we defied probation and decided to get married. During the 2 years we lived together, I overdosed and was administered Narcans at least 3 times that I can remember. I also had a suicide attempt where I was administered Narcan then, and when I woke up, I signed papers to never resuscitate me again because I felt like death was my only way out of this hell. I also, that year, ended up in jail for the first time, and my life just continued to spiral out of control at a very quick rate. He left me in the fall of 2004, and I decided to try treatment for the second time. It was there in the winter of 2005 that I heard of Suboxone for the first time. A requirement to get on this medication was to find a prescribing provider at home, which I did, and I was then prescribed the medication. It worked to help me get my life back together, but I still had trouble staying clean for any amount of time. Relapsing for me is just part of who I am and part of my disease. I have had wonderful doctors and counselors in my life, some for more than 20 years, who never gave up on me, even at times when they had even every single reason to. I've also had people in the medical field treat me as if my life and me as a person are disgusting and not worthy of the same medical treatment as a non-addict because my addiction is to prescription medications. I continued on Suboxone for 11 years, which I now feel was a disservice to myself as it kept me in an addictive state of mind and behaviors. I continually over those years got into trouble with the law, and it wasn't until last year that I finally got out of the system after 16 years. I didn't blame anybody but myself because I was never completely honest with my doctors, and they were only doing what they thought was helping me. Last summer I decided to try to come off Suboxone, a decision I made on my own, and it was decided with my doctors not to go cold turkey but to go on naltrexone and see how that would work. It was the best decision I ever made, and I'm so grateful for it. My life became clear for the first time in over 20 years. Naltrexone is a blocker. It prevents cravings, it is non-addictive, and you don't get any type of high from it. And there are no withdrawal symptoms when stopped. I would recommend it to anyone who truly wants to fully get their life back. Suboxone or buprenorphine in the short term can also be as effective. But in the longer term, I believe naltrexone or Vivitrol, which is the injectable form, is the best way if needed medication assistance to come out of active use and become a productive, healthy person. Today, my life couldn't be more amazing. I'm a recovery coach. I speak out about this disease anywhere I can to give a voice to others that don't have one, to show that there is a life after the depths of hell of this disease, and that hopefully giving back and helping others with my experience, strength, and hope will give somebody a chance, even one person. I have cleared my Hep C. I have beautiful, strong relationships with my family and children. I have an amazing, wonderful man in my life. I'm able to function in life where I never dreamed I could possibly do again. And after 8 months of being on naltrexone, I am finally able to live my life off meds, clean and sober.
Insurance is very important in the recovery process. It can be discouraging for many addicts to actually seek help because you're looking at tens of thousands of dollars of cost for recovery, going to a center, IOP, the various means of trying to actually get help. The state recently, keep in mind that many of these people, their main focus is not, let's get insured and get to a doctor and make sure I'm on the right meds. The main focus is their addiction, which is the prevailing force in their life. So when they actually do come to the point where they want to find recovery and get out of that force, there needs to be a way that they can be covered. There needs to be a way that they can seek help. And the state of New Hampshire they've gotten a little ways there. So a lot of the ways that how they got there was through the federal law, the Affordable Care Act, otherwise known as Obamacare. So Obamacare pushed the many states to actually more or less force Medicaid expansion, which is good for addicts who are trying to seek help. It's political to some, and it's money to a lot. And when you're weighing whether or not to spend money, I always like to view it, as I was taught in school, what is the opportunity cost? So the opportunity cost of not having addicts, alcoholics, people struggling with addiction insured is you're having, first of all, you're going to have high emergency room visits. They're not going to pay for those because they are not insured. The emergency room, the hospital, is then going to have to eat that cost and pass that cost on to the actually insured people. They're going to pass it on to the state, because many times they're given grants for that. So they're going to eat into that grant, which they could be using for something else, which also could be helping alcoholics and addicts. The opportunity cost is also that those people might not even ever seek treatment because they know they are not covered. And that does a lot. Right there, they could be looking at a list of rehabs and they could be saying, I would really love to go here, but there is no way in the world I can afford to go there. So I'm going to go over briefly private insurance, some of the changes in law, and that I'm going to highlight some of the changes that the Affordable Care Act has brought to the state of New Hampshire, the federal system in general. So there is, of course, insurance companies cannot deny pre-existing coverage for pre-existing conditions. That means substance abuse and mental health. So if you have a history of alcoholism or addiction of any kind, if you have a history of schizophrenia, anything that in the past they could deny you coverage, they cannot do that anymore. So an addict can go to the marketplace, apply for insurance, and they will not be denied on the basis of a pre-existing condition, which is good. So because of this, it has led to a rapid expansion of rehab facilities, because now they know that there's going to be people in those health plans so they can get paid. It's all about money. You need the money to actually open up a facility, and you need to know that the people that are coming to the facility are going to have someone to pay. Many times the facilities that, for a long time, facilities would have addicts and alcoholics come on grants. So somebody would sponsor an addict to go to a rehab. No longer is that needed. You can actually be covered. The facility will get paid. They know they'll get paid, so they can take in more recovering people seeking recovery. And that was during the rollout of 2014. So, partiality. We're going to talk a little bit about partiality and what that exactly means. So, there is one loophole in the Affordable Care Act. Partiality. So they only have to cover to a certain extent of what they would cover for a normal medical cost. Substance abuse help is not considered a normal medical cost. It's sad, but it is the truth of our society, is that we do not view addiction completely the same as we view having COPD, having diabetes. We don't view it the same. And we're slowly working down the stigma, and the 2014 rollout helped break down that stigma in the private insurance marketplace. So there's the 10 benefits requires only a bare minimum of addiction treatment coverage, leaving out medication coverage. This is private insurance, medication coverage such as methadone. So what Sherry was talking about, methadone and different long-term options to get people off of heroin for the time being and use something else that is not, it's not going to kill them. It's the biggest thing to say there. It's not going to kill them. Those aren't covered under most private insurance plans. In the state of New Hampshire, you'll be lucky if you can find one that will. There's two ways to purchase health insurance in the state of New Hampshire. There is the state exchange, and then there's the federal exchange. The state of New Hampshire kind of does a hybrid version, so you can either go to either one or purchase off the exchange. There's currently 5 health insurance companies you can purchase from, and that list includes what was known as Maine Community Health is now Community Health Options, Harvard Pilgrim, Minuteman, Anthem Blue Cross, and AM Better. You can also, the enrollment period for that ends in November, but if you are applying for Medicaid, you can enroll anytime during the year. It's very important to know because many recovering addicts, they're not going to be able to pay the premium cost of applying for private insurance. They're going to be applying for Medicaid, and that is available all year. You can, at any point, you can apply for Medicaid if you need Medicaid. The federal government funded up until, I think it's next year, 100% of the Medicaid expansion. Next year it goes down to 90. The year after that it goes down incrementally, I think it's until 70%. And because of that, many states, they would rather not expand Medicaid. Medicaid is very important, again, for people seeking to get help because they don't have the funds, the money to actually apply for a private insurance plan. They're immediately, when they go to the emergency room, many times they're being signed up for Medicaid as they're sitting there getting an intake. That's how bad it is many times. They're not predicting the day beforehand. You know, I should really think about getting insurance. That's the last thing on our priority list. Medicaid is supposed to be, you know, the last thing you're supposed to seek. So New Hampshire Medicaid is, they pay for a couple different things. They pay for screening, they pay for outpatient services, they pay for intensive outpatient services, or IOP, they pay for partial hospitalization done in an outpatient clinic, they pay for residential services, they pay for opioid treatment programs, which is methadone or buprenorphine, and they pay for office-based medication-assisted treatment, and also withdrawal management. So that that's about everything. Medicaid will pay for about everything for an addict, and that's very important to think about when you're voting. So there are a couple of bills up in front right now, and they're interesting to say the least. One is proposed by the Democrats, and one is proposed by the Republicans. HB 1690 is proposed by the Democrats. HB 1696 is proposed by the Republicans. The Republicans have a part in here that's called a work requirement. To be eligible, a person must spend at least 30 hours a week at work, training, community service, or at least one of several other qualified work activities. And there's a list of criteria. And this obviously does not apply for people on the Needy Families Program, and they're only people who are considered able-bodied. That would require a new waiver. It's very important to note that. A waiver is required for anything. We already do have one waiver with the CMS, which is the Centers for Medicare and Medicaid at the federal level. And they approve whether or not we are going to receive federal dollars for our Medicaid expansion. We have one waiver already because we allow for a partial privatization of our Medicaid system. That means some of our dollars, our tax dollars, could be instead diverted to a patient seeking to have a private insurance plan. But because this one is, this Republican-backed plan, the only one that's passed, thank God it at least got passed, is the only one that is probably going to get passed in the near future. It's also the only one in the entire country that goes to this extent that even requires a work requirement. And because of this, there's a high probability that we will have our federal dollars pulled. And there is a small little piece of legislation in the middle of this bill that says if we have our federal dollars pulled, we will not pay for the portion we are supposed to pay for. So basically, all that effort's for nothing. So we really have to either hope that the federal government says, okay, we're going to allow this work requirement and we're going to allow a waiver. So the state of New Hampshire's allowed this waiver and they're allowed to have this different Medicaid expansion than any other state in the nation, which would set a precedent. I mean, obviously set a precedent. Or we don't have Medicaid expansion.
I'm a face in recovery, and I came here tonight because I really wanted to, kind of a selfish reason, wanted to talk to my community. I have used a substance from the age of 13 to 44 years old. And for me to maintain my sobriety and maintain my recovery, I need more. And that is more treatment centers, more treatment places. I'm not going to sit here and try to explain what addiction is, because only people that are addicts really understand what it truly is and what we need. And I feel like, for me, about 4 years into my sobriety, I just hit 5 years. 4 years into my sobriety, I was feeling kind of at that cusp of like, well, is it really worth it? You know, am I really, should I stay where I'm at? You know, life kind of got okay. Recovery. What I'm finding in my community is people don't understand. You know, you go to an emergency room for a broken arm, they fix the arm, and it's done. You know, people, what I'm finding is people assume you send somebody away for 30 days and they get off the substance and then they're fixed. Well, that's not so. It's not so for me. For me, being in recovery means that I need to have programs to be able to go to and to be able to rely on. And, you know, I don't want... So at that 4-year point, I was feeling kind of like stuck. And I saw this movie called Anonymous People. And to me, it changed my whole outlook. I no longer felt ashamed to be an alcoholic and an addict. And I wanted to do more. I wanted to do more for my community. And as I saw people dying, including friends of mine, and you'd think that like 17-year-old people would be dying. No, I lost a friend who was 47 years old to an opiate overdose, heroin overdose. So I wanted to change. I wanted to do something for the community. But what I found is people don't want to talk about it. People don't want to step up and say, hey, I'm in recovery. You know, it's this stigma. And for me, what I'm finding in the community is the lack of services, meaning recovery centers, places where I can go and continue to grow in my sobriety and my recovery. So I got on this panel of Sullivan County and I looked at really what a small amount of services we did have for the people that were hurting, the people that are addicted to drugs and alcohol. And, you know, I just want to let people know it wasn't my mother's fault that I used drugs. It wasn't anybody's fault. It wasn't the traumas. It wasn't this. It is what it is. I am an addict. I will always be an addict. That will never change. What I don't want to change is me being in recovery. So if I don't have a place like a recovery center or a group to go to, that may happen. That may have me slip back because I feel like our society puts this stigma on it. And when I was struggling to get sober, and when I did at 44 years old, I had nowhere to go. I didn't know how to do a lot of things in my recovery. I didn't know how to balance checkbooks, pay bills, nothing. I didn't know how to parent. I had teenage kids. Legs were off, no food. I was losing everything. And I feel like we're missing something. And I know in my heart the only person that can help another addict or an addict is another addict. So I'm not going to sit here and try to explain that, but I want our community to know that it's happening here. People are dying. You know, nobody wants to talk about it. Nobody wants to believe in it. Because I'm in recovery, I get to see my grandchildren. I got to see 2 of them born. You know, my life has changed in 5 years. And I need to make sure I maintain that. And I want our community to be involved and to know that these people can recover from this. There is hope, but we all need to work together and able to support this community and make it a better place, you know. I am somebody's daughter, I am somebody's mother, I am somebody's grandmother. Like somebody said, I didn't think growing up I was going to become an addict. I never dreamed that I would be addicted to opiates, never in a million years. And it happened. And I used for a long, long period of time. And I just want people to know that as a community, as a whole, we need to start talking about it and getting out there. I don't expect people that are not addicted to anything to ever understand this disease, because I don't think it's possible. But I know I feel safe with other addicts, and I need a place to go to, and I need Sullivan County to start to step up. So I'm in the process of trying to help us to get a community center or something that we can go to as recovering people. And I just want to give some hope that, you know, if I can do it, anybody can. And you know, parents out there, grandparents, it's not their fault. This is just a disease. You know, when I was in my 1-year sobriety, I was told I had cancer, and the doctor said to me, "Oh, you have the good kind of cancer." And I just remember thinking, what the hell are you talking about? It's like saying I have the good addiction. You know, oh, I'm not addicted to heroin, or I'm addicted to just smoking pot or something. It's ridiculous. So I just want the stigma and people to really know that, you know, it's a disease. It's not something that I chose to have and to have for the rest of my life. But I have to maintain it. If I don't maintain it, I will go back to using it. That is a fact. So with that.
Hi, I'm Jim Doherty. I just scribbled stuff down. I didn't do like homework like Andrew did. That was great. That was awesome. But kind of nervous when I was going to read this. So I am a person in long-term recovery, and what that means to me is that I've been able to stay away from drugs, including alcohol, since January of 1987. I am the real deal, and my addiction took everything. My recovery started with 65 days in a treatment program, inpatient. Then I was in a halfway house for 6 more months. Since then, I've maintained my recovery with 12-step programs. But I could not have done any of this without the housing options I had in those early days. I often try to find treatment for people, and recently when I called around, the only place I found would not take him without hospital clearance, an emergency room. And we sat down and filled out the insurance paper, the Medicaid papers there. And even then, they put him on a 2-week waiting list, and he had to call every day to check in. And then before they would accept him, he had to again go to the emergency room to be cleared again. In the meantime, he was homeless and detoxing. In this film, we heard an official say they can detox at home. That assumes that our friend has one. In many cases, that is the definition of the bottom. Even if our friend has a place to live, many times it isn't a good place for early recovery because other residents are misusing drugs there too. We tend to surround ourselves with people like us. In fact, our whole life gets arranged around our drug habits. And some people do die while detoxing. Many in early recovery have been unemployable for a time. Many have created other health issues through neglect and malnutrition. Dental problems are common. Legal problems are common. Even some driving under the influence charges are felonies, making it hard to find work. These people need housing. Some need detox beds, some need a safe home, and some time to figure out what to do next and how to do it. Beds. We need beds. I live in Unity and have a second house where some in early recovery are living. We call it Tranquility House. I only have 5 beds. I meet men who need help with 12-step groups, get calls from friends or the jail. The people I am working with are eager to have a better life and are willing to make difficult changes in their life. But it takes time, patience, and encouragement. I think they need a safe place to start, like I do, and the time to get involved with the recovery community. My goal for Tranquility House is to help these men get their lives together, many for the first time. I personally have known some of those who have died recently. Some don't choose recovery. We need to make it easier to choose. And sometimes our window of opportunity is very small. It's not their fault they have this thing. They are sick, and we have to help them until they can help themselves. We just heard a police department, I think it was the Gloucester Police Department in this movie, say they get a person a bed in the same day. In this area, we need that ability. When someone is ready for treatment, we need to have the bed ready. Every life is important. We need beds. And, you know, I have a house in the woods in Unity, and I'm not a professional, and I feel like I'm ill-equipped to do a lot of what I'm trying to do. When I finally get somebody a bed, it's in Manchester or Brattleboro, or, you know, there's nothing here. There's absolutely nothing right here. And if there is money available, I don't even know who we need to talk to. You know, I don't know who's going to, you know, hear what I have to say out here in Claremont. But I feel like it's good that we have an opportunity to at least say it here. And maybe some people will whisper to some of their friends, and maybe the word will get out that we need help here. And, you know, I'm doing what I can, but I can't do much, you know. And the kind of help that I feel like we need is like Dr. Katie was saying, where did they go? Who do we call? We have nothing to do with these people. Day one, we need a place for these people to go. We need beds. So that's all I have.
People like me who prescribe Suboxone are limited to prescribing for 100 patients. Well, Obama suggested to Health and Social Services that they please raise the cap to 200, so that would essentially double the capacity for us to actually treat people who need treatment. So that's a long answer to your question. Let me say one more thing about the chronic disease thing that we heard down at the other end, which is really, really important. And that is, yes, addiction is a chronic disease, but it gets treated like an acute disease. You're supposed to go to rehab one time, and then that's supposed to do it. And, you know, everybody expects that. If you had diabetes, and you were taking the time, and you respond to insulin, you know, then that's considered effective treatment. And if you quit taking your insulin, then people say, oh, well, they had a good treatment, they just stopped, but they still have an effective treatment. With addiction, it's if you go to just straight rehab and you flunk, it's, yeah, forget it, they lose their chance. And it can't be treated that way. It's a chronic illness, which needs a lot of treatment. The more treatment contacts, this is alcoholics and everybody, the more treatment contacts that any patient has, whether it's AA meetings, patient visits, inpatient rehab days, anything, the greater their chances are to recover.
When we knew that the United States, the leading cause of death in the United States were heart attacks, guess what? Everybody was trained on CPRs. We had middle schoolers, high schoolers learning how to do CPR. Well, guess what? Heroin is killing our teens. So we all need to learn, number one, what Narcan is. Number two, what to do with addiction. So we're going to see billboards somewhere, I hope someday, that says, hey, call this number. Oh, this is what they're taking. This is the place you can go for meds. This is who's admitting patient for you. Same way we were treating heart attacks years ago, because this is killing them.
The fact of the matter, though, is that we live in a free market society. So there are going to be commercials with alcohol in them. There are no commercials with heroin in them. There are not people on commercials shooting up heroin. There are not people on commercials smoking meth. These don't exist, yet it's still problems in our society. I think it's important to remember that just because they're there doesn't mean there is an actual causation. It's important to remember that yes, alcohol is prevalent in our society, so is smoking, but smoking rates have gone down. Maybe there is some credit to what you're saying about bringing down the advertisements for alcohol, because bringing down the number of advertisements for smoking has been proven by the CDC to reduce the rates of teen smoking. Maybe it is time that we as a society take a look at how we are marketing to our youth what substances are doing to us. Is alcohol really something that is to be praised upon in our commercials, in our media? Should we take a nice hard look? Maybe we should require some better regulation on this.
I would just like to say that, I'm an alcoholic, and I am completely different than those people who are not alcoholic. And I've been sober a long time, like you have, but my system is completely different than those people who are not alcoholic. There are people who are able to have half a glass of wine and walk away from that. I don't know what they're thinking. You know what I mean? That's not my thing, right? Like, when I drink, the phenomenon of craving takes place, and I continue. I have no choice in the matter. But that's not the reality for America in general, right? Like, there are people who enjoy the taste of something alcoholic. That's not the case for me. I don't care what it tastes like. When I drink, I'm going for effect. I'm a different type of human being. It's like as if I have diabetes, or it's like as if I was born without a leg. I'm not going to be ever different. That's the way I'm going to be. But those people, here in America, the free market society, business gets the market to those people. And if I have a problem, that's my problem. I have to deal with my problem. But the majority of Americans can have a drink and enjoy a beer at a baseball game or something. I can't do it. And I wish I could, because I love to drink. But I do it.
We are fortunate that Taysa Bruno and Chris, along with Hope from Recovery in Manchester, opened a satellite recovery center in Newport, and they are doing exciting, wonderful things to help out the recovering community and enlightening people and giving different experiences on how to get strength and hope from others. So we are making progress.
Hi, my name is Kim Thompson. I am the care coordinator at Habaco in West Lebanon, New Hampshire. And I wanted just to point out a few things. The difference between Suboxone and methadone in New Hampshire is in our facility, we are a daily dosing facility, which means people come to us to get their medications daily. They can go on vacation, they can go away. It does require a little bit of process to it. You have to find someplace else to get your medication if you're not at a point where you are capable of taking your medication with you. In New Hampshire, for Suboxone, Medicaid in our facility does not cover Suboxone. It only covers if it is prescribed by a doctor, meaning you get a prescription and you take that prescription to a pharmacy. We do not do that. Therefore, New Hampshire Medicaid will not cover our facility for Suboxone. We do have Vermont people who come get Suboxone because Medicaid does cover that for them. I get anywhere from 3 to a dozen calls a day, people looking for help. We currently have a short wait list, but that's because we're short on counselors. This is one of our counselors with me. So depending on what somebody calls and asks for, some people have a preference between Suboxone and methadone because of a previous experience. Some people have allergic reactions. Some people do better with the naltrexone. So it's kind of a question and answer. What works better for you? Let's find the best thing for you. If they can't handle medication in a prescription, they can't handle 5 days at a time because they're going to take 3 or 4 days at one time and then sell the rest because they want to go buy heroin. Our facility would work better for them until they can get to a point where they can learn how to manage themselves and their medication. So it's all on a person by person basis.
Find your legislators' phone numbers and email on the web, and that's where it starts. It's what the people want, and if you desire to have your resources put in places, we need to tell our legislators about it. That's because we elect them. Everybody in this room can do something with the information they have. They can say they want more information. They have ideas about being part of the solution. You want to talk to your legislators. You need help. That's part of the solution as well.